Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Sotatercept in patients with pulmonary arterial hypertension at high risk for death. Background. Sotatercept improves exercise capacity and delays the time to clinical worsening in patients with World Health Organization, WHO, functional class 2 or 3 pulmonary arterial hypertension. The effects of add-on sotatercept in patients with advanced pulmonary arterial hypertension and a high risk of death are unclear. Conclusions. Among high-risk adults with pulmonary arterial hypertension who were receiving the maximum tolerated dose of background therapy, treatment with sotatercept resulted in a lower risk of a composite of death from any cause, lung transplantation, or hospitalization, greater than or equal to 24 hours, for worsening pulmonary arterial hypertension than placebo. Oral semaglutide and cardiovascular outcomes in high-risk type 2 diabetes. Background. The cardiovascular safety of oral semaglutide, a glucagon-like peptide 1 receptor agonist, has been established in persons with type 2 diabetes and high cardiovascular risk. An assessment of the cardiovascular efficacy of oral semaglutide in persons with type 2 diabetes and atherosclerotic cardiovascular disease, chronic kidney disease, or both is needed. Among persons with type 2 diabetes and atherosclerotic cardiovascular disease, chronic kidney disease, or both, the use of oral semaglutide was associated with a significantly lower risk of major adverse cardiovascular events than placebo, without an increase in the incidence of serious adverse events. A Phase 3 trial of Upadacitinib for giant cell arteritis. Background. Giant cell arteritis is a systemic vasculitis with limited treatment options. The efficacy and safety of Upadacitinib, a selective Janus kinase (JAK) inhibitor that blocks the signaling of several cytokines, including interleukin-6 and interferon gamma, are unknown in patients with giant cell arteritis. Conclusions. In patients with giant cell arteritis, Upadacitinib at a dose of 15 mg, but not 7.5 mg, with a 26-week glucocorticoid taper showed efficacy superior to that of placebo with a 52-week glucocorticoid taper. Next, we will be discussing articles from Journal of American Medical Association. Add-on treatment with Zilebesiran for inadequately controlled hypertension. The CARDIA-2 randomized clinical trial. Question. Does adding the RNA interference therapeutic Zilebesiran to a commonly used first-line antihypertensive drug produce additional blood pressure reductions in patients with inadequately controlled hypertension? Findings. In this Phase 2 trial, a single subcutaneous dose of Zilebesiran 600 mg, added to indapamide, amlodipine, or olmesartan background therapy showed significant additional reductions in 24-hour mean ambulatory and office systolic blood pressure at 3 months, regardless of background treatment, meaning these data support the potential for use of subcutaneously administered Zilebesiran as an effective and well-tolerated treatment for continuous control of blood pressure, in combination with commonly used first-line oral antihypertensive medications. Dexmedetomidine or Clonidine-Based sedation compared with Propofol in critically ill patients. The A.I.O randomized clinical trial. Question. Does primary sedation with dexmedetomidine or clonidine, alpha-2 adrenergic receptor agonists, compared with Propofol-based sedation, usual care, decrease the time to successful extubation in critically ill patients receiving mechanical ventilation? Findings. In this pragmatic, multi-centered, randomized clinical trial, including patients expected to require at least 48 hours of mechanical ventilation, neither dexmedetomidine nor clonidine-based sedation decreased the time to successful extubation compared with propofol-based sedation, meaning among critically ill patients expected to require at least 48 hours of mechanical ventilation, neither dexmedetomidine nor clonidine-based sedation was superior to propofol-based sedation. Next, we will be discussing articles from Annals of Internal Medicine. Trends in utilization of glucose and weight-lowering medications after Tirzepatide approval in the United States. Background: recent trends in use of Tirzepatide, a dual glucagon-like peptide-1, GLP-1, and glucose-dependent insulinotropic polypeptide receptor agonist, RA, versus other glucose-lowering medications, GLMs, and weight-lowering medications, WLMs, remain unexplored. Conclusion: these findings highlight the sharp uptake of Tirzepatide after U.S. market entry and enhance understanding of the rapidly shifting landscape of prescribing patterns for GLMs and WLMs. Next, we will be discussing articles from British Medical Journal. A village doctor-led mobile health intervention for cardiovascular risk reduction in rural China. Objective: to assess the effectiveness of a village doctor-led mobile health intervention on cardiovascular risk reduction among residents in rural China. Conclusions: the village doctor-led mobile health intervention was effective at reducing cardiovascular risk and improving control of behavioral and metabolic risk factors. This feasible approach could be scaled up in rural China and other under-resourced settings to improve health management based on the local primary healthcare system. Next, we will be discussing articles from Lancet. Negative pressure wound therapy versus usual care in patients with surgical wound healing by secondary intention in the UK, SWASI 2, an open-label, multi-center, parallel group, randomized controlled trial. Background: surgical wound healing by secondary intention, SWASI, presents a substantial management and financial challenge. Negative pressure wound therapy, NPWT, has increasingly been used as a treatment despite an absence of comparative evidence of effectiveness. We evaluated the effectiveness of NPWT compared with usual care for improving time to wound healing in patients with SWASI interpretation. In patients with a lower limb SWASI, including those with complications of diabetes, there is no clear evidence that NPWT reduced the time to wound healing compared with standard dressings. These findings do not support the use of NPWT to augment SWASI healing. Here are the articles from Journal of Hepatology. Utility of AI digital pathology as an aid for pathologists scoring fibrosis in MASH. High inter- and intra-pathologist variability is a significant challenge in MASH scoring. The use of artificial intelligence, AI, digital pathology, DP, to aid pathologists in fibrosis scoring, improves inter-pathologist variability. This increases confidence in inclusion and exclusion for clinical trials and treatment response evaluation. The use of AI DP holds the potential to improve clinical trial efficiency. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Human enteric glia diversity in health and disease, new avenues for the treatment of Hirschsprung disease. Background and aims. The enteric nervous system, ENS, which is composed of neurons and glia, regulates intestinal motility. Hirschsprung disease, HSCR, results from defects in ENS formation. However, although neuronal aspects have been studied extensively, enteric glia remain disregarded. This study aimed to explore enteric glia diversity in health and disease. Conclusions. Two major enteric glial classes were identified in the pediatric intestine, highlighting the significant postnatal contribution of Schwann-like enteric glia to glial heterogeneity. Crucially, these glial subtypes persist in ganglionic segments of patients with HSCR, offering a new target for their treatment using 5-HT agonists. Here are the articles from Clinical Gastroenterology. The complex relationship between pain, mental health, and quality of life in patients with cirrhosis undergoing liver transplant evaluation. Goals and background. Patients with cirrhosis undergoing liver transplant evaluation have high rates of pain and mental health comorbidities. Both may significantly impair health-related quality of life, HRQL. We investigated the association between pain, anxiety/depression, and HRQL in this population. Conclusions. Pain is present in over 70% of patients with cirrhosis undergoing liver transplant evaluation. Anxiety and depression were highly correlated with pain and appeared to be key drivers in predicting poor HRQL. Evaluating and managing mental health comorbidities should be explored as a strategy to improve HRQL in patients with cirrhosis and pain. Next, we will be discussing articles in the field of rheumatology exploring the association of socio-demographic factors and primary diagnosis with transition readiness in adolescents with rheumatic disease. Objective. Transitioning from pediatric to adult care is challenging for adolescents with chronic health conditions. The Transition Readiness Assessment Questionnaire, TRAQ, is a validated tool for measuring transition readiness in pediatric patients with chronic diseases. This study examines the association of socio-demographic factors and primary diagnosis with transition readiness in adolescents with rheumatic disease using TRAQ scores. TANS conclusion. In our cohort, transition readiness varied by primary diagnosis. Transition plans tailored to the needs of vulnerable adolescents are required to enhance health management skills and facilitate a successful transition. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Association of patient sex with inpatient mortality after elective primary total hip arthroplasty for osteoarthritis. Objective. This study aims to evaluate the association between patient sex and discharge disposition, as well as inpatient mortality, following elective primary total hip arthroplasty, THA, for osteoarthritis, OAA, in the United States. TOTS conclusions. Female sex was a risk factor for non-home discharge, but not in hospital mortality after elective primary THA for OAA. It remains to be seen whether better patient health optimization with clinical pathways and targeted interventions in females undergoing elective primary THA can reduce the complication rate. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Exploring integrin alpha-5 beta-1 as a potential therapeutic target for pulmonary arterial hypertension. Background. Pulmonary arterial hypertension, PAH, is characterized by obliterative vascular remodeling of the small pulmonary arteries, PAs, and progressive increase in pulmonary vascular resistance, leading to right ventricular failure. Although several drugs are approved for the treatment of PAH, mortality rates remain high. Accumulating evidence supports a pathological function of integrins in vessel remodeling, which are gaining renewed interest as drug targets. However, their role in PAH remains largely unexplored. See conclusions. These findings establish alpha-5 beta-1 integrin as a pivotal driver of PAH pathology, and we propose its inhibition as a novel, safe, and effective therapeutic strategy for PAH. Here are the articles from Journals of the American College of Cardiology. Disentangling the impact of adiposity from insulin resistance in heart failure with preserved ejection fraction. Background. Obesity, insulin resistance, IR, and diabetes are common in heart failure with preserved ejection fraction, FPEF, and are associated with worsening heart failure, but their independent contributions remain unknown. Hg, 95% C, plus 0.11 to plus 0.27 mm Hg per kilogram/m2, P less than 0.0001, but diabetes was not. Conclusions. Excess adiposity is present in most patients with HFpEF, even among those not considered obese according to BMI, calling for further study of cardiometabolic therapies among patients with HFpEF and excess adiposity with BMI, less than 30 kilograms/m2. Although excess body fat is associated with IR and diabetes, cardiac remodeling, hemodynamics, and functional impairment are independently correlated with body fat, but not IR. These findings suggest that diabetes is primarily a marker of greater adiposity and HFpEF, with less direct impact on heart failure severity. From JAMA Cardiology. Clinical phenotype and prognosis of asymptomatic patients with transthyretin cardiac amyloid infiltration. Question: what is the clinical phenotype and natural history of patients with asymptomatic transthyretin, ATTR, cardiac amyloid infiltration? Findings: in this cohort study of 485 patients with asymptomatic ATTR cardiac amyloid infiltration, those with grade 2 or 3 cardiac uptake had greater rates of disease progression and a 5-fold higher risk of cardiovascular death compared with those with grade 1 uptake, in whom non-cardiovascular death was predominant, meaning these findings support the use of disease-modifying treatments in patients with ATTR cardiac amyloid infiltration with grade 2 and 3 uptake and highlight the need for large-scale studies to assess their role in grade 1 uptake. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Fetal/maternal determined birth weight and adulthood type 2 diabetes and its subtypes, a Mendelian randomization study. Background: lower birth weight, BW, might increase the risk of adulthood type 2 diabetes, but its associations with the highly heterogeneous type 2 diabetes subtypes remain to be studied. In addition, whether the associations between lower BW and adulthood type 2 diabetes risks depend on fetal or maternal effect is largely unknown to inclusion. Fetal determined but not maternal determined lower BW were associated with increased risks of adulthood type 2 diabetes and its subtypes. Our results underscored the importance of early targeted management among people with a low BW in the prevention of type 2 diabetes. Here are the articles from Diabetes Care. Cardiovascular and Kidney Outcomes and Mortality. With long-acting injectable and oral glucagon-like peptide, 1 receptor agonists in individuals with type 2 diabetes, a systematic review and meta-analysis of randomized trials. Background: glucagon-like peptide 1 receptor agonists, GLP-1 reduce the incidence of major adverse cardiovascular events, MACE, in type 2 diabetes, T2D, although whether benefits extend to both subcutaneous and oral formulations remains unclear. See inclusions. As a group, long-acting GLP-1 including both injectable and oral formulations, reduce incidence of MAC, HHF, and kidney events and all-cause mortality in T2D. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Stability and accuracy of a diagnosis of Parkinson's disease over 10 years. Background and objectives. Accurate diagnosis of Parkinson's disease, PD, remains challenging, with variability and clinical uncertainty, especially in non-specialized settings. Despite advancements in diagnostic criteria and biological markers, misdiagnosis continues to affect patient care and research. This study aimed to assess the long-term diagnostic stability of PD and evaluate the accuracy of initial diagnoses over time in a large, consecutive cohort, diagnosed by neurologists, with or without movement disorder specialization. This study demonstrates significant diagnostic instability in PD, with 13.3% of diagnoses revised, primarily within 2 years. When DLB is considered separately, the revision rate increases to 17.7%. Despite frequent DAT imaging and limited post-mortem examinations, clinical uncertainty persists among practicing neurologists, contrasting with lower misdiagnosis rates in specialized centers. These findings highlight the need for systematic application of diagnostic criteria, regular reevaluation of diagnoses, more frequent autopsies, and the development of accessible diagnostic biomarkers. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Video versus direct laryngoscopy for tracheal intubation after cardiac arrest. Background. Airway management is a critical component of the care of patients experiencing cardiac arrest, but data from randomized trials on the use of video versus direct laryngoscopy for intubation in the setting of cardiac arrest are limited. Current American Heart Association guidelines recommend placement of an endotracheal tube either during CPR or shortly after return of spontaneous circulation, but do not provide guidance around intubation methods, including the choice of laryngoscope. Research question. Does use of video laryngoscopy improve the incidence of successful intubation on the first attempt, compared with use of direct laryngoscopy, among adults undergoing tracheal intubation after experiencing cardiac arrest? Interpretation. Among adults undergoing tracheal intubation after experiencing cardiac arrest, use of video laryngoscopy was associated with increased incidence of successful intubation on the first attempt and shortened duration of laryngoscopy, compared with use of direct laryngoscopy. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Impact of the Capture Chronic Obstructive Pulmonary Disease Screening Tool in U.S. Primary Care, a cluster randomized trial. Rationale. The impact of screening for chronic obstructive pulmonary disease, COPD, on U.S. primary care clinician behavior and patient outcomes is unclear. Objectives. We sought to assess the impact of receiving screening scores for clinical and patient outcomes using the COPD assessment in primary care to identify undiagnosed respiratory disease and exacerbation risk. Capture tool. Conclusions. Within these U.S. primary care practices, COPD and Capture education plus receipt of Capture screening scores did not change clinician COPD assessment or care or patient outcomes for Capture Plus patients. However, in the pre-pandemic period, Capture Plus patients were more likely to undergo spirometry referral completion, whereas for Capture Minus patients, clinicians were significantly less likely to assess for COPD, suggesting that the intervention resulted in a more appropriate use of healthcare resources. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. High-diversity plant-based diet and gut microbiome, plasma metabolome, and symptoms in adults with CKD. Key points. Increasing plant diversity, greater than or equal to 30 plant foods/WK, reduced symptom burden and shifted the gut microbiome toward beneficial metabolite production. Increasing plant diversity was more effective for individuals with more advanced kidney disease and higher levels of uremic toxins at baseline. Increasing plant diversity, in addition to usual diet care, resulted in a substantial reduction in potential renal acid load of 47%. Here are the articles from Kidney International Reports. Kidney transplantation improves survival in antineutrophil cytoplasmic antibody-associated vasculitides with end-stage kidney disease. Introduction. Antineutrophil cytoplasmic antibody, ANCA-associated vasculitis, AAV, frequently leads to end-stage kidney disease, ESKD. Although kidney transplantation, KT, is considered the optimal treatment for ESKD, its survival benefit in patients with AV remains understudied. This study aimed to determine the impact of KT on survival in waitlisted patients with AV-induced ESKD, AV-ESKD. Conclusion. KT is associated with a significant survival benefit in waitlisted patients with AV-ESKD compared with waiting on dialysis. These findings emphasize the importance of timely transplant evaluation and improved access to KT for this population.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.